Actually, I was, want to be a scientist in medical science, but I became a patient myself, and that kind of changed the trajectory and the way I was taken care of. Actually, made me change my mind and become a doctor. Vascular medicine is a multidisciplinary specialty. We see a lot of referrals, not only from family doctors or primary care physicians, but a whole range of specialties, including rheumatology, for other inflammatory diseases that manifest in vascular disease, as well as hematology. I have specific interest in lower extremity wounds and ulcers. It's interesting, most of vascular wounds that affect the lower extremity may be primarily from the vessel itself, from blockages due to atherosclerosis of the artery, or it could be from blood clots in the veins. The cause is very broad, and I usually look at the patient as a whole to try to come to a diagnosis and a treatment plan. I ask the patient what do they do for a living, what their hobbies are, what their hobbies are, and all those questions will help me kind of tailor a treatment plan that is specific to the patient. Vascular medicine actually has a lot of chronic illnesses, so when we see patients, we basically, most of the time, we see the patient, long term through their illness, because most of these illnesses are chronic, and I get a lot of joy in the fact that I'm in a patient's life for that period of time, taking care of the patient. The most rewarding part of my job is when I see a patient. I've had instances where a patient comes to me and has had different diagnoses for an illness, for instance, a vascular-related illness, and the patient comes with volumes of records, and I walk in the room, and it takes me 10 minutes to make a correct diagnosis, and the patient is very satisfied after that.